struggling or worried about more than just weeds, she called the Elder Helpline and spoke with a volunteer Shine counselor about her options. There, she received free, unbiased counseling on health insurance for those on Medicare. For more information or to volunteer, call 1-800-963-5337 or go to floridashine.org.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. If you see us on Facebook or streaming there, we are at Celebrating Life today on location 2400 Northwest Boca Raton Boulevard, also known as 2nd Avenue in Boca Raton. And tonight, this evening, we're going to be talking about telemedicine, introducing a breakthrough telemedicine device for patients with serious or chronic health conditions. And along with us on this adventure of health to talk about it is Lou Biasi. You'll remember him. He's the Vice President of All County Healthcare and CEO of American Telemedicine Services Incorporated. We'll give out the number here, 561-278-2222, and I'll give it out a few more times during the evening. But without further ado, welcome to the broadcast. Lou, how are you doing this evening?
Thank you, David. Thank you for the introduction. You know, I've been in the home care business for almost 30 years now, and I've seen tremendous changes happening in healthcare. What is happening right now, as you can see, we're going through a tremendous amount of turmoil in healthcare. One of the biggest things today in the election is what people are concerned about their healthcare. Medicare, for instance, which takes care of seniors 65 and older or totally disabled, and they're either on straight Medicare or they're on Medicare Advantage. You know, what has happened is, through the years, cost of healthcare has gone up tremendously. And, you know, how do you control costs? Medicare is always looking to control cost. And how do you give the patients better care? So about 2 years ago, I got together with a gentleman out of New York who basically was coming up with a product we call telemedicine. Telemedicine was used in the past, and right now it's going through all kinds of changes. But what is happening now, Medicare has allowed doctors to bill for telemedicine. So if you're sitting out there and you have a chronic care condition, or you have multiple disciplines like high blood pressure, or you have diabetes, or whatever you may have, the doctor now we almost can have a hospital at home. What I'm saying is, through our telemedicine product, which is called Live Care, which we established now, we launched it about a month ago, and it's the most amazing thing that I've seen in telemedicine. What we do is we provide the doctor provides the patient with a monitoring device, a blood pressure cuff, an oximeter. You can also have a wireless scale. You can have a blood glucose bundle. You can have a health tracker. You can have a wireless pulse oximeter. This is installed in the patient's home. Every morning the patient gets up. He can take his blood pressure. He can take his pulse oximeter reading, and if he has get on the scale, this is all transferred into our monitoring device. which can be worn around the neck or sets on a cradle next to the bedside. All this information is going into our monitoring station, which is transmitted into the doctor's EMR system. Now, what does that mean? That means if you're not seeing a doctor and you have multiple ailments, we want to make sure that something serious hasn't happened in the course of the day. This is being monitored 24/7 by our monitoring stations with RNs, EMT people who will check this daily. And if something happens that's out of sync, for instance, your doctor will set the protocols. He will say, okay, if your blood pressure is over this, call me. If your weight goes to 4 pounds, 5 pounds higher, call me. If your glucose goes up so much, call me. So the factor is they're keeping an eye on you at home constantly through our device called LiveCare. LiveCare is the name of the product, which is installed in your home. It also can be worn by you if you leave the home as a necklace outside. You remember the old system, Dave? The old system was, a mobile help. Who picks me up when I fall?
Mm-hmm. And
I
then
fall and I can't get up, and they press a button. When they press that button, what happens? 911 comes and takes you to the hospital. 70% of those people at 911 comes don't have to go to the hospital, according to EMT people, right? So what our device has done is prevented hospitalizations by saying, when our monitoring station's on, our people will talk to you. Maybe you forgot to take your medication. Our device has a medication reminder. Our device also has a fall detection. If you're outside and you're wearing our necklace and your balance isn't so great, like mine sometimes isn't so great, they might tell you, yeah, you're going to fall, sit down. And it comes over our speaker, says you're going to fall, sit down. Now, this is a visual device. It's the only one of its kind. It's patented. You don't need any cell phone, anything. Your family can call you, the doctor can call you, we can call you. They can see where you are with this device, okay? So let's say, for instance, you have a wound or you have a problem. The doctor can call you and look at you, see if you have a wound, and if the wound is not being taken care of, he can look at the wound. He can look at you. He can take your temperature. He can do everything with this device. Now, if you have to be hospitalized, then they'll say, come on into the office, or they'll call 911 for you in the middle of the night if that has to happen. It's the most amazing thing I've seen, because when it's visual, people can see where you are, right? Now, if you leave the house and you get lost, which some people do, it has a GPS system on you. We know pinpoint exactly where you are, okay? So that primarily covers all of the devices. Now, here's the key thing. Your doctor will give you this at no charge if he decides that he wants to call remote patient monitoring. He wants to monitor you on a daily basis. Now, he can spend so much time monitoring you, and he can submit a bill to Medicare, which covers the cost of the device, covers his services, and you pay absolutely nothing. So it's free to you, right? So when you have a hospital at home that's free, it's amazing. Now, it has multiple uses. The key thing is you don't need a cell phone. It can work off wireless. It can work with your Wi-Fi. It can work from a cellular connection. We have 24/7 help call. If you need help, you just press the button, help will get on the phone with you. It has a two-way audio and video, right, through that device, as I told you. It's charged, wireless charging. It's charged. It sits on a cradle. It's being charged. It has voice activation. It has medication reminders. You can call your home health care company if you have a home health. You can call your family member. Somebody can send you a note. You can read it right on our monitoring system. So it has anything and everything that you might need if you're staying at home and you're home alone or you're home with someone. Now, why is this so important today? It's so important because we're trying to cut hospital readmissions. If you cut hospital readmissions, what happens? We hope the cost of health care will go down. Because what is happening, if you constantly get readmitted to the hospital, like people have chronic care diseases, COPD, cardiac, what are the two main causes for basically readmissions? It's either, we call it chronic care management, it's either because of cardiac or pulmonary. Pulmonary meaning COPD. cardiac. It also has a cardiac monitor on it, right? If you can have AFib, you can have a cardiac problem. Now, this will monitor you in the course of the day and the night, right? So if something's serious, we will be notified, you'll be notified, right? It's almost like a life-saving device too, all right? So as you can see, this thing is going, telemedicine is going to be going. Google now, you see, has a Google Watch, this thing. One of the things that we differentiate from anything else is that we're HIPAA qualified and we're also FDA approved. So if we're HIPAA qualified, FDA approved, that means your doctor now can use this, as I said, give it to you, monitor you. Now, when he's monitoring you, he's also working with you, and now he can bill Medicare for his services. And this means you're going to be getting this free. The other factor is people say, well, what's the other use? Well, I got that button that I push. I got that watch I'm wearing. Mm-hmm. And if I fall, I press it, somebody comes on, and if I'm not feeling well, they send 911, right? Well, our device says you might not have to need 911, right? I remember because I used to wear the watch, okay? And it went off automatically a couple of times. And at 3 o'clock in the morning, I got the fire department knocking on my window, want to take me to the hospital.
When you didn't even have maybe an ailment?
When I had nothing wrong with me, right? It just went off, okay? Well, they insist they want to take me to the hospital. I said, I don't need to go to the hospital. Well, they had to come in and check everything and did it. I finally convinced them I didn't have to go to the hospital. But I'm using this device now. I'm constantly being monitored. I check my blood pressure in the morning. I check my glucose in the morning. I also check my oximeter, my oxygen levels in the morning. And as things progress, at the end of the month, my doctor gets a report. If he sees something wrong, he'll call me during the day or call me that night, or when he sees something wrong, he'll say, I want you to the office because we're looking, your blood pressure's fluctuating too much. I want to come in and see you. I want you to come in and see us. So he can bring us in, he can change our medication, again, without having any serious effect. The product is called Live Care. And Live Care took us 3 years to develop. And we're also constantly trying to improve the product line. But it's out, we put it out about 3 weeks ago, right? It's out now, it's being used by a number of physicians. And also, I found another use for it. Being in the home health care industry, we also do respite and custodial care. Respite and custodial care is, let's say you needed mom or you or whoever that may be, might need 4-hour care, 8-hour care, 24-hour care with a CNA. Mm-hmm. All right, that's right. Some families can afford 24-hour care today. Most families can't afford 24-hour care. They might only have 4-hour care. What happens with them for the rest of the day? What happens to the other 20 hours? What happens if they're in 8-hour care? What happens to the other 16 hours? If they install this product into their home and they decide they want to pay for it themselves, they can get it. We install it free. All they pay is a monitoring charge. All right? We give them all these instruments, right? Now, what does that mean? If you took the cost of the monitoring, which would be $65 a month, and you multiplied that over 24 hours a day, 30 days a month, you're paying 11 cents an hour.
Well, that's a pretty good deal.
11 cents an hour to save your life. So if your home health aide decides to leave you at 8 hours, you need something there from the time she comes back until the time you see her again. Other than your cell phone, because you might not be able to get to your cell phone. Let's say you're sleeping at night, right? And you're having chest pains. Well, you press our help button, right? Help comes on the phone. They'll talk to you. They'll find out if you took your medication. We'll tell you to take let's take your blood pressure again. Let's take your vital signs again. Now, if your vital signs are out of whack, we'll call your physician. We'll call a family member. And if you have to go to the hospital, then they will expedite a 911 call. So for 11 cents an hour, you have total protection. So, if I'm going to be home alone and I'm a senior, what happens most of the times with seniors? When they get out of bed, they want to go to the bathroom, they trip and they fall, right? That's when most incidents happen. Now, they're left alone, they're on the floor, they can't get nothing. All they have to do with ours is press the button, call for help, and help will come, okay? So we have so many uses for this that it's unbelievable. First, remote patient monitoring. Now, if you're a chronic care patient, and you have multiple diseases, then this is what you need to keep you from going to the hospital. We're working with a company that primarily has a number of patients. They have a lot of patients. And a lot of these patients now, let's say they might have 10,000 patients. They have 10,000 patients. Out of that 10,000, 300 patients constantly go in and out of the hospital. Well, that's a major cost factor for the Medicare, for the patients, for everybody. So what we're doing, we're installing, it's almost called hospital at home. Every device that you think of, the scale, the blood pressure cup, the glucose, the oximeter, the heart patch, the heart monitor, is given to that patient. So daily, he's being monitored, right? That's like having a physician at home daily. Because when you go to a physician, all he's going to do is take your blood pressure, take all these things, take all these signs. He's going to make a determination, right? Your heart's not working properly. Your blood pressure is too high. You gain too much weight. If you gain too much weight, that means you might be retaining a lot of water, right? Your oxygen levels are low, so you might have a problem breathing, right? As a result, that patient is constantly being readmitted in and out of the hospital. That cost to the patient, the cost to the Medicare is astronomical. It's like a frequent flyer in and out of the hospital. He doesn't want to constantly go in and out of the hospital. Now, if you look at Mrs. Bush, President Bush's wife, Barbara Bush, she had, I think, COPD.
She did. I remember the story.
And she was going in and out of the hospital to a point where she says, I don't want to go to the hospital anymore, right? And she just passed away at home. If she had something that we could monitor with, something like this, we would know when she was basically in a situation where she had to be hospitalized, okay? So with these instruments, and plus what All County has, if you have, let's say, chronic care and you have COPD, All County Healthcare is the only agency that can treat you at home for COPD with an IPV, interpulmonary ventilation system. So I'm going to hopefully be giving this to all our patients as they go home as an additional protection for them, right? So if you're sitting out there and you're a home care agency or you're a patient of a home care agency or you're not feeling well and you want something to keep you safe at home, then I strongly suggest you look at our Live Care product. Look at us. You go to livecareusa.com, www.livecareusa.com. You can call me at, as I said, 561-278-2222. We'll have one of our representatives come out and talk to you. We can start you immediately with this product, right? Go talk to your physician, talk to him, tell him what we're doing with you. And the product is self-explanatory as far as help saving your life, right? We shouldn't really say saving your life, but it's another possibility that you will have to protect you from being either into the hospital or something serious happening during the course of the night. And if something happens seriously during the course of the night and you don't have anybody to call, then what's going to happen? You're going to call 911, right? So again, if you're being monitored, I'm on remote patient monitoring right now with my physician, and it's working out tremendously well. My blood pressure fluctuates. They'll tell me, Lou, your blood pressure is fluctuating. We might have to make a change in your medication, right? Your oxygen levels stay constant, right? You get on a scale. I know I got to lose weight, so I'm in the process of losing weight. And if you have any kind of heart ailment, which I have a slight heart ailment, they're concerned about you gaining water weight. If you gain water weight, that's a problem that can develop into the heart, right? So again, Live Care is the name of the product. There are a lot of products out there. I want you to remember, this is HIPAA compliant. It's FDA approved. It's gone through all the testing through Medicare. Your doctor, we will notify your doctor that we're putting you on remote patient monitoring, and he might want to say, okay, I want to take this product, and we will teach him how to bill Medicare for it, okay? Or if you don't want to basically use it as a remote patient monitoring device, you just want it as a protection in your own home for yourself, then you can pay for it for 11 cents an hour. It's pretty reasonable.
It's a pretty
Right?
good deal, yeah.
So if you're paying $20 an hour, $18 an hour for home health aid, and you're doing 8 hours a day or 10 hours a day, remember, the rest of the day, in the evening, you're alone. You want something there to help you. And since I've gotten this device, and I've been using this device, Live Care, I can tell you, I sleep better, I feel safer. Because what all people want, all seniors want, they want three things. They want to live healthier, they want to live longer, and they want to live safer, right? So if I want to live healthier, I want to eat the proper foods, I want to live healthier, I want to live longer. This might help me live longer, but it sure as heck going to help me live safer. If someone, I see something breaking into my home, I can press the help button. Something unusual happened, I can press the help button. So this is what telemedicine. There's a lot of products that are coming out right now on telemedicine, and look into it. Look into what you think is the best fit for you. Now, telemedicine is the wave of the future. And everybody eventually is going to have some kind, if they're sick, they have chronic care problems, they have a few diagnoses that has to be monitored daily, this is the way to go. Because you're not going to go into a doctor's office every single day,
No.
right?
No one does.
No doctor wants to see you every single day, right? No patient wants to go in every single day. But I know a lot of patients are taking their blood pressure at home every day. If they have diabetes, they're taking their glucose readings every day. But what are you doing with it? You say, oh, okay, my blood pressure's high today. What am I going to do? Oh, my levels are high for glucose, right? I gain weight. Okay, you don't know what to do with it. But with this device, it's being monitored into our monitoring system, which is being transferred into your doctor's EMR system. What does EMR mean? Electronic medical records. He's seeing your records on a daily basis.
Yeah, it's capturing the data.
He's capturing all your data on a daily basis. Mm-hmm. So when you go in to see him, let's say the average patient today, Medicare patient, might go see the doctor 5 times a year, right? Okay, 5 times a year. Let's say he goes five times, and there's 12 months in a year. What happens with all 7 months? What's happened to your system? Now, if you think you're feeling well, and you don't have a device like this, you might not be feeling well. You might have something going on. So what happens? You got to wait for your next checkup before you decide you want to go into the hospital. Go in to see the doctor, okay? Well, a lot of times people go in to see the doctor, they have this thing called white coat syndrome. All of a sudden they take their blood pressure, and what happened to my blood pressure? Oh, gee, right? Well, when you're home normally, and you're doing it daily, right, he has a better reading, just like your glucose, your blood sugar, he has a daily reading of what's going on. If he sees something wrong, he's going to call you in, all right? So this is the wave of the future. This is medicine in the future. As you can see right now, you see advertising. I think it's Baptist Health. Care on demand. All right? Care on demand. Meaning you can call Care on Demand and you can talk to one of their physicians over the phone. Okay? What is he going to do? He's going to talk to you over the phone. If you don't have a blood pressure machine, or you don't have a glucose monitor, or you don't have one of our devices, what's he going to tell you? How do you feel? What's your blood pressure? I don't know. What's your glucose reading? I don't know. But if we give you all of these for free, right? For free, that means you take it daily. Now, he knows exactly what's going on with you.
Ooh, that's our music. Yeah, no, I think that's it. So, again, the number is 561-278-2222. Give Lou a call, and then we talked to a lot of doctors on this show, and they can give you a call as well. And there's a special code there, for the charges. So we'll see you next time on the Living a Longer and Healthier Life show.